Well, good morning, everybody. Good morning. I want to thank you all for joining us this morning, making the effort to be here. As the ranking member of the House Committee on Veterans Affairs and the chair of the Equality Caucus, I had the privilege of working alongside many of you to improve the lives of those who have served this country. And for those of you that I have not worked with yet, I genuinely look forward to our collaboration in the future. Our conversation today and the work that many of you perform touches on veterans from all walks of life, whether it's from the point of view of veterans who are racial and ethnic minorities, women veterans, LGBTQI plus veterans, but also elderly veterans and those in rural communities, and veterans that are not yet engaged with the VA at all. So I don't think I need to tell anyone in this room that the barriers to equitable access for these veterans, that these barriers are long-standing. Nor do I need to remind us that all that the things that will not change without dedicated action from multiple administrations, several sessions of Congress, and many days spent researching and advocating. I liken it to kind of pushing a huge boulder. And we move it a bit at the time. Sometimes it gets a little easier. But eventually we get to where we need to go and get that boulder to go where we need to go. During the Biden administration, we saw the establishment and growth of programs dedicated to serving minority veterans, from investments in research, the creation of offices like the Office of Equity Assurance, and the increased collection, analysis, and use of demographic data to bridge gaps in access. And I was proud to lead one of the largest expansions of veterans benefits in a generation, the Honoring Our Pact Act. This legislation was designed to capture the true impacts and costs of war and included the tools to connect more veterans to the services and benefits they've earned. The PACT Act is for all veterans, and I worry that this administration is choosing to end this inclusive approach and pick among specific groups of veterans that they prefer. In the last 4 months, we have witnessed a myriad of executive orders directed at dismantling efforts aimed at providing care and benefits to veterans who might not otherwise be connected to the department, like Black, Latino, and Native veterans, or making the environment of that care hostile, as in the case of LGBTQI plus veterans. We have heard from clinicians that these executive orders conflict with their core values of, quote, inclusion, advocacy, and ethical care, end quote. We have seen the implementation of a chaotic return to office mandate, which for many has added to a growing culture of fear and discrimination, particularly for transgender veterans and employees. We have heard stories from VA employees and veterans who are being harassed in the restrooms at work, as they now are required to use bathrooms that match their birth sex. We have heard reports of halted outreach efforts to tribal communities who, according to analyzed VA data, already utilize VA programs at a lower rate than other racial and ethnic minorities. And we have witnessed the degradation of VA's world-class research enterprise, where researchers will no longer be able to consider purposely diverse populations and topics in their work. I hope today's conversation will shed light on these challenges to better help members of this committee understand what is happening on the ground right now. However, I also hope we will begin to create a roadmap of what we all collectively must do to ensure VA's work to address discrimination and disparities. And I hope that all will continue. We will not rest until we can ensure that all veterans receive the care and benefits that they've earned. I'd like to start today with some brief introductions, and if you would, I would just ask that you say your name and the organization you are from so we can all get to know each other. But before I do so, I want to make sure we acknowledge the ranking member of our Economic Opportunity Subcommittee, longtime colleague of mine, Congressman Chris Pappas in New Hampshire. So Chris, thank you for being here today. So why don't we start to my left and begin with these introductions. So go ahead. If you could just repeat your organization again into the mic.
Sorry.
That's
Thank
better.
you,
Way better.
Congressman.
Yes, thank you.
I'm Danny Vargas. I'm the chairman, founder, and CEO of the American Latino Veterans Association. We exist to help the 1.5 million Latino veterans in our country today thrive and recognize their indispensable contributions to our military throughout our nation's history, and the 250,000 Latinos serving on active duty today once they separate from active duty to make sure that they have pathways to great jobs and starting great businesses.
Thank you. Welcome.
Good morning, and thank you for having DAV. I'm John Retzer, Deputy National Legislative Director for Health, to bring our perspectives on this very important issue.
Thank you.
I'm Larry Romo. Today I'm representing the League of United Latin American Citizens, LULAC. I'm the Vice President for Veterans. We're the oldest civil rights organization, but we have a large amount of veterans nationwide. We have over 1,100 chapters around the country. Thank you.
Thank you.
Good morning, Michael Wishney, Yale Law School. I direct the Veterans Legal Services Clinic. Thank you very much for including us today. We've been involved in litigation on some of these issues, and some of our clients are in the room. Good to see them.
Great.
Hello, my name is Richard Brookshire. I'm the co-founder and co-CEO of the Black Veterans Project. We've been pushing forward a reparative framework to contend with the legacy of benefit obstruction faced by Black veterans and their families.
Great.
Good morning. Great to see you again. My name is James Albino. I'm the former executive director for the Center of Minority Veterans. I was put on administrative leave in February, so I'm currently unemployed. I have a bunch of resumes here if any of you have any ideas.
Good morning. I am Edward Oscar DuBose. I serve as the National Chair of the Armed Services and Veterans Affairs Committee, also a member of the National Board of Directors of our organization. On behalf of our Chairman of the Board, Leon Russell, our President, Derek Johnson, we are so grateful that we had an opportunity to be at the table. To all of the members of this committee, thank you.
My name is Christina Keenan. I am the Legislative Director at the Veterans of Foreign Wars, the VFW. And while we have over 1 million veteran members who served in overseas conflicts, we advocate for all veterans. Thank you.
Great.
Good morning. My name is Jeff Holcomb, and I am still with Veterans Benefits Administration, the Office of Equity Assurance. As many of you know, we have been put on paid administrative leave, and will be officially closed on Monday. So, but we're grateful to be here and to be a part of this conversation.
So who are you with again?
Veterans Benefits Administration, VBA.
Okay.
Yes, sir.
Great.
Morning, I'm Megan Miller. I'm with the Department of Veterans Affairs on administrative leave from the Office of Equity Assurance. We serve all veterans, and we look to find ways that there are barriers in the delivery of care and services to veterans and find out what the root causes are and how to eliminate them.
Good morning, Congressman. Peter Perkowski here representing Minority Veterans of America. Like many of the others, we do take an intersectional approach to equity and justice issues, including reparative justice for LGBTQ veterans, racial and ethnic minority veterans, women veterans, and religious and non-religious minorities.
Great. I think I recall that weren't you at the Harvard Project before? Or?
Yeah, I do still work at the Harvard Clinic, yeah.
Okay, you still work there?
Yeah.
Okay. I recall many of you. Well, welcome everybody. And I want to invite someone I've worked with before, when I was the chair of the committee, to set the scene for today's conversation. And I mean for this to be kind of a conversational moment. I mean, I think maybe if you want to say something, put your card up like that. just your placard. But Richard Brookhiser, why don't you, I'm going to recognize you for 5 minutes or so to kind of set the scene for today's discussion.
Thank you. Thanks again for having me. I want to tell a bit of my personal story as well. I am a Black vet. I served in Afghanistan, served 7 years as an Army combat medic, and had a difficult transition out beginning in about 2016. Struggled to gain access to mental health care through the VA, and found myself on the other side of a suicide attempt. And it was when I survived that suicide attempt that the work of the Black Veterans Project was born. Alongside my colleague, who's sitting over there, or standing over there rather, Kyle Bibby. And so over the course of the almost 7 years, we've been building out a reparative framework to contend with the legacy of benefit obstruction faced by Black veterans and their families all across the country. And so what does that begin to look like? Really, the work started to culminate because of a really thoughtful partnership established with Yale Law School back in 2020 at the height of the protests that were happening around the death of George Floyd. Where we decided that we wanted to start to take a look at data and see how we could leverage internal data to hold the VA more accountable, not only about reparative justice, but about fostering a greater level of equity. Knowing that what we were seeing and what generations of Black vets had been speaking to wasn't being adequately addressed. And so we did a FOIA effort, had to litigate that effort. It ended up becoming one of the largest race-based data queries in the history of the Department of Veteran Affairs. We looked at 20 years of race-based data relating to disability compensation. That data proved decades of veterans' complaints correct, that there were in fact sustained and systemic disparities in the allocation of disability benefits, but we also knew that didn't necessarily stop there, that there was a legacy of this embedded at the VA that went all the way back to World War II and likely before that, but certainly began to take shape around the inception of the GI Bill, where decisions were made about the allocation of benefits that would lock millions out of the ability to benefit from their service and sacrifice in the same ways as their white counterparts. Our work ended up leading to Senator Warnock's introduction of a bill around a GAO study on racial disparities that would come out in 2023. That study would look at the last decade of disparities in disability compensation, but prove our work to be correct. It would also help and assist with the structuring of the Office of Equity Assurance at the VA, where there were real efforts taken under the Biden administration to seriously contend with these issues, and like the colleagues that I'm very fortunate to be in conversation with today, said to look into the root causes and begin to address them. The work that's being done on the outside, though, is equally important. Monk versus United States is a historic case that has cleared two major legal hurdles, and Mike Wishney will likely speak more to it over the course of the last 2 years, but it is leveraging much of the data that we were able to glean and making the argument that the VA had been deliberately negligent in their addressing racial disparities in veterans' benefits going all the way back to the inception of the GI Bill. And Conley's Monk, whose story is so powerful, is a Vietnam vet who fought for over 40 years to gain basic access to PTSD care, to compensation for his injuries in war, everything from education benefits to housing benefits and what have you. Many of us know the myriad of benefits that come out of service. And so it seemed as though, and I started to work with this committee as well in 2020 to build out a coalition of Black veterans groups to contend with the GI Bill Restoration Act and take a more holistic approach, looking both at the legislative strategy but also litigation. It seemed like we were on the precipice of really fostering a level of equity at the VA. And now we have an administration who's come in and in less than 100 days seemed to dismantle programs that took decades to foster and build. The dismissal of key employees, to include James Albino, who's been working on the inside for years to try to get one of the biggest institutions in our country to be responsive to these issues. And I'll just say that, the Trump administration already has a history of obstruction, because it wasn't until our FOIA efforts came around that we discovered that there was a most recent study in 2017 about disparities in disability compensation relating to PTSD that administration deliberately buried and did not act on. And so they already have a history of not wanting to contend with these issues, but actually undermining efforts to contend with these issues. And the consequences have been expansive. Just looking at the disparities in PTSD compensation, we believe that about 100,000 black vets across the country, specifically in the South and in Puerto Rico as well, were unjustly denied PTSD compensation and care over the course of just the last 20 years to the amount of almost $2 billion in lost resources. So this is not minuscule amounts. These are life-changing amounts for black veterans, black families, and the communities from which they come from. And I'm just very humbled and grateful to be in community with you all to figure out how we can carry on this work, but also how we can beat back some of the nefarious things that are being done to just undermine equity overall. Thank you.
Thank you, Mr. Brookshire, for that. And I'm brimming with questions, but I want to acknowledge my colleague, Ms. Sherfless McCormick, has joined us, and welcome. I'm so glad you're here. And members are just juggling all sorts of conflicting assignments today and markups and whatnot, and with no votes tomorrow, this is kind of the last day we're here. So to have them here, know that you're really important. Mr. Albino, perhaps you can also kick us off here. What has outreach traditionally looked like at the Department of Veterans Affairs, and why is it important to reach veterans where they are, and how have you all seen this outreach change over time?
Certainly, thank you. Thank you for the question. Traditionally, before I joined the Center for Minority Veterans, outreach consisted of VA sending staff to a location, putting up a table, have a bunch of tchotchkes on the table, handing out papers and flyers, and then packing that up and leaving. And so it wasn't very intentional or deliberate. When I came on board, I realized that engagement and outreach effort was not very effective. We were not collecting data on it. We weren't even strategically conducting the outreach, and as a consequence, started looking at data. One of the first pieces of data that I ran across came from insistence of the Advisory Committee on Minority Veterans, that they had, for 11 times in 22 years or so, had impressed on the VA and to reports to Congress that these inequities were existing. So we started looking at that and looking at the available data, and sure enough, one of the reports that came out was the 2017 Lewin Accenture report that demonstrated that black and brown veterans were getting maybe about 10 to 12% different grant rates than their white counterparts. So I started looking at more data with the intent of being more intentional in our outreach effort. And we realized that bringing the VA to the veteran was important. So in the case of Latino veterans, for example, we brought the VA to the LULAC conference. I think it was in San Juan a couple of years ago, and we had a whole staff of folks there that conducted CMP exams, conducted interviews, and started processing. We also held 2 events with the NAACP, 3 events with NAACP in Georgia, in Nevada, and in California, where we basically built a small VA hospital there, and we had everything, not hospital, small VA, we had everything from NCA to VBA and the health system. And the value of that, and this is a story I like to tell, is that the value of that is that if we don't bring the VA to the veteran, especially with underserved communities that already have low trust of the VA, particularly women and black and brown veterans, then they're not gonna come to us. They're not gonna naturally come to us. And the story I tell is that this woman during the NAACP conference in Nevada came to us, hitchhiked an hour and a half to get there in 110-degree weather to pick up her husband's records because she didn't have them and they were trying to file a claim. She told us that she was unemployed, was soon to be unemployed, was homeless, living in a worker's apartment. Her disabled husband was in a wheelchair-bound place, so they were separated. Long story short is that it turns out that he had filed a claim many years ago, and because he was frustrated with the experience at the VA, just dropped it. So for 20-something years, that claim stayed in processing without anybody moving it. That day, we were able to adjudicate that claim, got her a $30,000 benefits package that came over that many years, got her a HUD-VASH voucher so she could get an apartment. Turns out that she's a veteran. She served 2 years in the Army, got her claim started, and then prepared her to train to be a caretaker. So bringing the VA to the veteran is very important, but to do that, we need the data. We need the data and the relationships with NAACP, with LULAC, with the Black Veterans Project. And part of the challenge that we've had is that data has been buried. That Accenture-Lewis study never saw the light of day. Following that, there's a MITRE study on barrier analysis. That never saw the light of day. There's another one for the Equity Project right at the end of the Biden administration, around 2023, around there. That never saw the light of day. So that data, along with the GAO study, demonstrate very clearly that there are veterans, Black and brown veterans, that are experiencing inequities. One of the things that we did in our office was work with your office to create a bill that reinvigorated the center and gave power to the secretary to do more research related to this matter. And thank you for introducing that bill. I think it was 2 years ago in June that you introduced that. And so the intent was to use data to be able to be more surgical about our approach. But if the VA continues to bury the data, and especially if they don't acknowledge that Black and brown veterans experience these inequities. One of the MITRE studies will show you that if 100 Black veterans go to New York and file a claim, about 90% of them will get processed effectively. If they go to Louisiana, 72% of them will get it. If they go to San Juan, 29% of them will get an adjudication. The same thing for a PTSD claim. Now, I'm not a doctor, but arthritis is arthritis is arthritis, right? I mean, people experience it differently across the board, but you can see what arthritis looks like. There shouldn't be one standard in Boston or one in Louisiana and another one in New York. And all of those reports point to examiner bias. I don't know what that bias is. It may be lack of training. It may be, I don't know, racial or discrimination, but it exacerbates the lack of trust that Black, brown, LGBT, and women veterans have with the VA.
Well, Mr. Albino, it strikes me in Puerto Rico's case, I mean, there's probably structural problems within the VA, but I think Puerto Rico, if it were a state, would have 2 senators and probably 3 representatives, is what I recall.
Correct.
At least 3 representatives. I think about the caseworkers I have working on veterans issues. I have at least 1 or 2 that will be seeing those veterans. And so in the case of Puerto Rico, you have 1 resident commissioner with 1 staff. But you have now, if it were a state, for the population you have there would be 2 senators and 2 other
Correct.
congressional offices. You're down like 8 congressional people who can run interference with the department, right?
Correct.
So that's maybe another 10, 20% of the cases that aren't getting resolved in Puerto Rico. So I want to be mindful of my colleagues here, Chris or Mr. McCormick, Sheila. I was kind of like remembering Sheila. Do you have any questions or anything you want to bring up at this point? Sheila, it looks like you can prepare with some stuff.
Yeah, I have several questions. I think my biggest concern is the intentional erasure this administration has been engaging in and how it's precipitating into the VA. As you mentioned, we've already been fighting this fight where we're intentionally trying to course correct and correct the history that we've all been born into in the United States. But with this intentional burying, this erasure, it's kind of trying to convince people it never happened. So it makes our work so much harder to do because they want us to believe none of this ever happened, it's accidental, it's coincidental, and it wasn't intentional. So I have real concerns, not even based on the work that we've done, but the work we're gonna have to do in the future to make up for this time period that we're in. And so my question to you is, what would you recommend for us to do kind of like forward thinking? you know, we're still fighting on this front to get them to acknowledge what has been done and for them to, for us as a country to correct the wrong that's been done. And now we're being forced to fight this idea of diversity, equity, inclusion, that everyone who is under that purview somehow, you know, got something they didn't deserve, and that they're in these positions because they don't deserve it, or there are no real distinctions between minorities and women that need to be actually dealt with. And so is there anything that, you know, thinking into the future that we could start building out now to course correct? Because the damage that's being done now is, I'm afraid, is going to reverberate for more than decades to come. So is there anything that you're seeing that we're not aware of that could have happened within these last 5 months? And do you have any recommendations for what we can do to future-wise to course correct also?
I would recommend a couple of things. The Office of Equity Assurance was a byproduct of those reports coming out, and internally we recognizing that this was a problem and trying to establish this office so that the issues related to equity would be addressed and corrected. Because we know that if we are intentional about that, we can do that. We can do that. And part of that is doing the outreach and engagement effort to these communities and course correcting that on a day-to-day basis. But that requires work. Dismantling that office is going to set us back decades, right? We also established in our office a platform, a policy platform for the LGBTQ plus community. We had a great advocate working with us, worked with us on a detail for a period of time, then went back to her office and was recently fired because of that work. Women veterans and LGBTQ veterans, particularly transgender veterans, don't trust us. And that kind of action sets a precedent where there's no real good reason to trust the VA. And so I think trust is one of the biggest efforts. I would recommend making the Office of Equity Assurance or some form of the Office of Equity Assurance, whether it's part of the Center for Minority Veterans or part of the Center for Women Veterans, as part of a statute that requires that. And
So that was what was going through my brain.
Yep.
Now, the office was set up administratively, and so it didn't exist in statute, and we didn't have someone Senate confirmed, so they could just come in and like take it apart. I'm worried about, I don't know about you, Sheila, but I'm worried about what happened to so you talk about these reports that were ordered. How many of them exist, and can we FOIA, can they be, is there any FOIA action where we're trying to get these reports out? I mean, I'm just worried about data like being destroyed or lost.
Well, I've made the reports available to your staff, and I'll send them out again. The ones that have the most impact are the three that I mentioned, but of course the GAO report under Senator Warnock and others are public reports, but I think I've sent those to your staff as well.
Okay, Mr. Brookshire, I seem to recall your organization was working on the data related to the GI Bill and related to the home loans, going back to World War II. I mean, you were in the process of suing. I mean, can you bring us up to speed on where that data, where it is?
So last semester, or in this fall semester, we worked with a team of students, and Mike Whitney can speak more directly to some of that. But we worked with a team of students in the fall of last year to begin looking at pathways to gain access to data relating to VA home loans. Didn't get that far, but we did get some data back. And yeah, can you speak to what else we have, I guess, at this point?
I'll just say it briefly, and glad to give more details to staff. I don't want to take all the time on some of these. I don't want to take all the time on these details. There it is. Glad to fill staff in. But we have submitted a series of FOIA requests over the last 3 or 4 years for the Black Veterans Project, which have prompted the release of these reports, data on disability compensation claims, as Richard said, and some data on home loan programs as well. We've had to litigate some of those, so we've gone to federal court on some of those requests because VA would not provide the data on behalf of the Black Veterans.
So even under the Biden administration secretary, they were very, they weren't cooperative in getting this data out. What's at stake for them, and what was the legal sort of?
I can't explain their reasoning other than, yes, unfortunately, it did take a lawsuit to force some of that data out.
Well, so some of the conversations that I've had were some of the reasoning why they didn't want, I think specifically data relating to the disability disparities was because of the privatization that was happening at VA and the legal exposure that some of those private companies might have, specifically the ones that perform tests on vets. So they basically are the ones that are essentially providing the documents to raters who would then work at the VA in some fashion, but the ratings are only based off of what comes out of the examination, and that process has been privatized.
In my effort to unearth this data, multiple times the Office of PA and I, Performance Analytics and Integrity, would comment that they would not want to share that data with anybody because it would put them at legal risk and potentially put the examiners at risk, which is absurd. So multiple times, even talking to the General Counsel, the Office of Inspector General, the whistleblower office, they were very concerned that releasing that data would ultimately lead to even more legal suits, which frankly, if that's what it takes to correct the issue, that should probably happen.
I guess I see Mr. Vargas, you have something you want to say?
Just briefly to the Congresswoman's point and question, I think there's a couple of different factors. One is, the data that we're talking about here, which has an impact today in the present. I think as we look to the future, we know that in the case of Latinos will be 18 or 19% of the total veteran population within 20 years or so. So there is a significant real-world impact. We can't put our heads in the sand, pretend that these differences don't exist. And in terms of looking at the past, I was quoted in the Washington Post recently when they did a story about removing references to ethnic minorities in the Arlington National Cemetery, saying you can shy away from DEI programs, but you can't shy away from history. So I think the storytelling is equally important to the data that we're talking about here. We need to make sure that all of us, members of Congress and VSOs and other citizens, are doing everything we can to continue to tell the stories of minority contributions to our national defense from the Revolutionary War to today. So anytime we have an opportunity to be able to highlight those stories, it's incumbent upon us to make sure that all Americans are cognizant of the contributions our communities have made and continue to make.
I'm going to recognize Megan in just a moment, but I don't want to lose this point with my staff. This thing about that they weren't releasing the data because of liability to the private examiners. If these examiners were VA-owned, would that liability still be there? I mean, I'm just seeing a big disadvantage in farming this stuff out to private contractors if it means that we can't track the disparities that I mean, is this a legal thing? Mr. Wishney?
My own view is that there is no defense under FOIA that applies here. So it might be the agency's initial position. I think it's wrong as a matter of law. It's sad that we would have to take that to court repeatedly.
You think it's kind of a bit of a made-up reason?
Yes, I do. I think it's a misread of the law.
Megan.
Thank you. I wanted to follow along with what Mr. Albino was saying. As far as outreach and targeted assistance, one of our biggest impediments is that the workers, we don't have data. That's something that historically VA has shied away from collecting demographic data under the guise of, if we don't ask, then we can't be making prejudicial issues. But that doesn't work when you have systemic issues, when there's infrastructure that disadvantages different groups in different ways. You have to be intentional to find out what the root cause is and how it's impacting different groups. So one of the biggest efforts that OEA was working on was finally getting our handle on some of that information. It could be broken down to congressional district, it could be by service period, it could be by race. We were trying to get further down to get other minority demographics as we went along, but we were starting from scratch, and that's information that wasn't available. In my prior work at a regional office, I did a lot of outreach, and it was very much what you said. We set up a big tent, we put flyers everywhere, we advertised nationwide, we would have people come from states away, and we helped everybody that we could, and we helped homeless veterans, and we did a lot of benefits on the spot, but we had no way of knowing if we were hitting the right people or the most people in need because it was all scattershot. And we didn't have outreach budgets, we didn't have money for overtime. So this is all something that needs to be centralized if it's going to be effective. And taking away OEA is taking away that intentionality, and it's taking away that focus, and finally getting a little bit closer to having the data we need to show that there's a problem and if we can fix it. Thank you.
Well, thank you, Megan. Peter?
Thank you, Congressman. I do want to point out a gap in our discussion here for LGBTQ plus veterans. We don't have a center. We never did. There was a proposal to put a few LGBTQ representatives on the CMB, and that came from, I forget which congressional office, but it didn't pass. And there's no amount of data collection will help this community because VA has never collected data based on sexual orientation or gender identity. And now, though, because of the eliminations of the DEI proposals and policies, all that data would be wrong because it would be reported, particularly for transgender people, would be reported on their sex assigned at birth. So to answer your question directly, Congresswoman, data collection and a center for LGBTQ veterans is something I think would be very helpful for our community.
Thank you. Ed DeBose.
Thank you, Congressman. I just wanted to James Albino point, not only am I chair of the Armed Services and Veterans Affairs Committee, but I was a member of the Center for Minority Veterans Advisory Committee. It was even challenging to get the information being a part of a committee where our responsibility was to make that information known. So even inside the Department of Veterans Affairs, it was hard to get that information. And I think now, as they dismantle, really tear down the Department of Veterans Affairs, I mean, everybody we reach out to now are gone. The Center for Women Veterans dismantled, the Center for Minority Veterans. I'm a part of that committee. We've rescheduled meetings since January. There has not been a meeting since January. In fact, on my way here, I got an email saying that we're rescheduling the meeting for May the 28th. Those are the challenges that are going on within the Department of Veterans Affairs, and all of this information about disparities at the same time is being pushed back. Thank you, sir.
Thank you. Jeff Holcomb?
Yes, sir. Thank you. I wanted to add to what Megan has said from the question that Ms. McCormick has asked. One of the other things that the Office of Equity Assurance was really intentional about doing is building relationships within our organization. And so we worked with all of the different benefits offices and business lines. And frequently the question was, why is equity work important? And so we found ourselves oftentimes educators in that area to explain and to fight back a lot of these straw man arguments about DEIA, to say, you know, it's not, equity is not about favoritism. It's not about preferential treatment. It's not about taking from one veteran group and giving to another. It is, you know, truly about making sure that all veterans, regardless of their status of, you know, who they are, that they, if they're experiencing any barriers to benefits, any access problems to their benefits, or even outcome issues, disparities, you know, how can we help them to overcome those so that everybody gets the same treatment, the same access? So again, I think that also has to be a big part of moving forward, is fighting that fight to say, you know, equity is important because it helps everybody, just like we pointed out, from racial minority, sexual minority, gender, even rural veterans and elderly veterans. I often, when I have conversations with people, point that out. Our executive director pointed out that, you know, 20% of our nation's veterans are considered rural veterans. And out of that 20%, approximately 70 are white men. And so equity work really is helping everybody. And so, you know, having that kind of education for federal employees, for even the general public, for veterans themselves, I think is crucial in moving forward.
Thank you for that comment. It strikes me that that message is very important for us to get out. Before I call on Mr. Wishney, I wanted to acknowledge, and I'm delighted at the presence of my colleague Delia Ramirez and Mr. McGarvey, Morgan McGarvey of Kentucky. Again, I'm delighted that I wasn't expecting so many members to be here, to be honest with you, because but we have so many competing claims on our time.
I want to congratulate Congresswoman Ramirez on the Pope, Chicago.
Viva el Papa. All right. So, Mr. Wishney, please.
Yeah, just briefly, the data conversation is deeply important, and in the litigation that Richard mentioned, the Monk litigation, we now have tools beyond FOIA, and so we asked the judge to force the VA to sample racial data going back to the 40s. The VA said we can't do it. The judge said, yes, you can do it. They've now asked him to reconsider, but I don't think he's likely to. We're taking the deposition of the longtime head of PA&I next week, and we'll learn a lot more. But you shouldn't have to veterans shouldn't have to go to court and use discovery to get basic information about the agency that is there, that Congress has established to serve them. So the data is deeply important, and it has to inform measures going forward, but I hope we don't get too hung up on the data in the sense that we already have a lot of data. We already know, without question, of historic racial disparities, of historic barriers to LGBTQ veteran access, and we know about historic disparities on gender. I wanted to end on that note and maybe think about looking ahead a bit. We know that when data demonstrated 10 years ago to VA that there were substantial gender disparities in PTSD claims, the VA took action. They did a series of management, like business school kind of internal management practices, and they closed the gap substantially, the gender gap in PTSD claims. We have a recent example of how an agency committed to addressing disparities can actually make improvements. And it wasn't necessarily rocket science. I don't mean to disparage the work that was done, but again, it was traditional business school measures of auditing and oversight, training, focusing on particular regional offices, and again, it worked. What was a substantial gender gap on PTSD claims in disability compensation narrowed almost completely. So there's the opportunity to use basic good management practices to address much of what we already know. Even as it's important to continue to gather data, we know enough. There's no need to wait to start taking action.
I'm very heartened to hear that, Michael Wishney, because I think one of the most important things we need to do is get legislation done on the home loan disparity, reaching back to World War II, the generational wealth that home ownership has meant for most Americans who were not minorities. I mean, I spoke to the vice president about this. One of the issues I raised when Biden first came into office and we were doing the first reconciliation bill. And I raised this point about the home loans, and everybody knows that black and minority soldiers were not able to get into certain universities post-World War II. And so the GI Bill was not available to them. I mean, we don't need data to tell us that we need to do some correction there, and at least to the errors. And we can figure this stuff out. We're not talking about going back to Reconstruction. This is a more recent generation. And knowing that if we were to address the home loan issue, we actually would make money, right? It's not going to cost us money to do this, to do right. And so I'm heartened to hear that you believe we know enough to be able to make the arguments that these things should happen, right? And the vice president told me, she said, you know, that somebody, she had heard that this issue over the home loans, you know, this is one of the biggest reasons why black Americans are so behind economically. They just weren't able to transfer that wealth. So, and I don't think it just affected black Americans. I think it affected other minorities as well.
And honestly, if I may, we know enough, and so does the VA. As part of this lawsuit, my students have spent time in the NAACP archives, reading letters in the 1940s from Jesse Dedman at the NAACP, the Veterans Affairs Secretary, your predecessor, to VA, saying this is the challenge of Black veterans returning from World War II being shut out of benefits programs. The VA has also known about this since the 40s. They have enough information to act as well.
Yeah, we know about the state banks that discriminated. We know about the redlining. We know how the home loan program just did not work out for Black Americans and other minorities. Any other members want to jump in here? Ask a question, because I've got, Larry Romo, and then I'll ask, Larry, you had something to say, and then. You got to get going, so, okay.
Go ahead.
Unfortunately, I have to head to a rally in front of the Supreme Court about birthright citizenship in a moment.
Thank you for that.
And glad to have introduced the legislation to affirm that if you're born in this country, you are a United States citizen. But I wanted to just say to you all, I'm incredibly honored to serve as a ranking member of Oversight, Accountability, Investigations in the VA. Particularly as I think about where we are in this moment and the disparities that we knew have been in the trajectory, right, of the Department of Veteran Affairs for many, many years, but specifically in this moment where you see them shutting down all of the programming that really has affirmed or even advanced in some ways any kind of equity. So I just want to thank you all for being here as we're preparing ourselves to speak to Secretary Collins this afternoon. It was really important for us to have this roundtable with you and really affirm what the ranking member has said, that when we're talking about standing up for our veterans, we're not saying standing up for a particular subset of our veterans. We're talking about standing up for every single individual who said, yes, I will take on this call to defend the country. And so I want to thank you for that work because I want to make sure that within our own subcommittee, we continue to push the fold. We continue to use the data that is available to us and really the stories, right? We said really making sure that we're affirming the storytelling that comes from this moment in the many ways that this administration is violating the responsibility they have to honor our veterans. And so I wanted to just ask a quick question, and maybe that's part of what you'd be answering. I came in a few minutes late. So if there were some specific red lines, necessities that when we're going in to fight and push back, we need to make sure that we're doubling down on, what would you say are the most important ones for us, especially as we're going into this committee hearing this afternoon?
Go ahead. No, you go ahead.
I just want to make a quick observation. Anti-DI is an excuse for discrimination.
Yes.
What we're concerned about in LULAC and other organizations is that we're actually going to be discriminated against, reverse discrimination, where if, like at service academies or wherever, if you have two equal candidates, one's Hispanic, Black, Asian, and one's white, they're going to say, well, we got to be careful, we're just going to pick the white. So we got to be careful with that, and I think that's real important. And I bring that to attention because what I'd like to see, like LULAC, we have a partnership with over 40 organizations, and we have lawsuits going on right now, like they're trying to pass where you could have this, all kinds of paperwork to show that allowed to vote nationally. Okay, so we have a lawsuit there with other organizations. Same thing with the veterans organizations, like my colleagues in the Black Veterans Project, LGBTQI. I ask you, at the appropriate time, if it makes sense, to invite LULAC, invite other organizations to join in a lawsuit, because we're all in this together. We're all veterans. When you're out fighting, we don't care what your background is. So we need to unite, okay? Team, the stronger the team, more weight we carry, and we need to call out. You only need to call out the Congress whenever. Trust me, I have a great relationship with a military writer, and I call out when they're discriminating against women, erasing pictures of Olga Custodio, Puerto Rican, the first Hispanic pilot. We just need to call it out, and luckily the media helps us call this out, because it is a disgrace to our country when they're erasing history. When General Brown was fired, that was a disgrace. General Brown started in San Antonio. That was a disgrace to this country. We just need to call it out for what it is. Thank you very much.
Thank you, Mr. Romo. Christina Keenan, VFW.
Yeah, I just wanted to provide a couple of personal anecdotes and then some perspectives from one of the large historical veteran service organizations. First, I'm an Army veteran. My mother was an Air Force veteran, Hispanic veteran, and she served during the Vietnam era, did not believe that she was a real veteran, and never took advantage of any of her VA benefits. I had a similar perspective, even though I served in the early 2000s, that I wasn't a real veteran until I came to be part of the VFW, understood that I was eligible for all the VA benefits, literally all of them. And I'm a priority group 1 disabled veteran that uses the VA for my health care. And even though I've been using the VA for my health care for many years, even at the DC VA, when I went in for emergency care, I was questioned no less than 5 times if I was an actual veteran, even though you have to show your ID to get into the door. This was not my first time at the VA. I've been there many, many times. I get all my care there. We've talked a lot about data and outreach, but the VA experience is incredibly important for all underserved veterans. That can be just the first experience in the door, can be that make or break moment, whether they decide they're going to use the VA or not. And we've heard this many, many times from our membership, from lots of different groups of underserved veterans, that their experience at the VA from different providers and staff has not been positive. So some of our survey data does show that. So training is really key, just sort of adding to some of the solutions. Training for comp and pen examiners, whether they're in the VA or contracted, is incredibly important, especially focused on biases. And then also medical providers and anyone that is interacting with veterans on a day-to-day basis. For our organization, our membership guides our advocacy through our resolutions. Our two of our resolutions focus on underserved veterans. One is focused on data collection and improving VA's efforts to identify and resolve some of these disparities in the claims process and benefits process. We also, last year, passed the VA Home Loan Correction Resolution, which enabled us to support Representative Clyburn's VA Housing Loan Forever Act last year. That piece of legislation is personal to me. As I told you, my own mother did not, as a Hispanic woman veteran during the 70s, did not take advantage of her home loan. And that is generational wealth that was lost. I served, so I have the home loan myself. But she grew up in a very poor family, and service was her way to better herself and educate herself, and yet she still lived most of her life without some of these means. So I'm proud that the VFW membership supports these efforts. We've seen legislation over the years on data collection and other improvements to the VA, and we hope to see more of those in this Congress that we can publicly support and try to advocate, because some of these things need to be in law, so that we're not subject to changes in the administration that can remove some of these crucial programs that have been beneficial, again, to underserved veterans, but all veterans. Thank you.
Thank you. Thank you, Christina. Mr. DeBose?
Thank you. Speaking to the point of taking down historical markings, I wanted to lift that point up because areas like the Tuskegee Airmen, our own Mega Evers, who was gunned down in his driveway, is a veteran. Jackie Robinson, people see him as a baseball player, but Jackie Robinson was a soldier. And so I think when we start to take down historical markings, you begin to try to erase history. And that's hugely important. And speaking of myself, I'm not only with the NAACP, but I didn't acknowledge when I started my presentation, I am a veteran. I experienced racism in the military. And so when I look to heroes like the Tuskegee Airmen, when I look to heroes like Jackie Robinson, Medgar Evers, it takes a punch in the gut when someone is trying to erase history. Yes. So I wanted to lift that point up. But I also wanted to make sure in recommendations, I'm a mental health professional also. And when I see the Veterans Crisis Line being dismantled, you're talking about a potential crisis in people who are struggling with potential suicide, depression. Already we know that diagnoses in Black and brown veterans and whites is different, right? Our PTSD is minimized, often overlooked. And so I hope that as we talk today, we begin to push back against those dismantling of very critical areas. And I'll say this and I'll stop. It's Memorial Day month. It's sacred. It's a sacred obligation that was committed to veterans. And how dare you take down and dismantle so many things that have benefited veterans. We're getting ready to go to the gravesite and listen to stories of people in our families and who have fought in different wars. At the same time, this administration is dismantling all of those benefits of veterans. Thank you so much.
Thank you, Mr. DuBose, for that. I just want to say that it is sacred, and I feel like what's been done is profane. Taking down Jackie Robinson, the history of prominent, the Tuskegee Airmen. The Tuskegee Airmen archives are at the University of California, Riverside, that I represent. When they took down and then put back up the 442nd on the Army website, the history of the 442nd, I know what you're saying, it punched the gut. I feel personally hurt. It was hurtful what they did. So I feel what you're saying deeply. Sheila, you have something you want to ask?
Oh, thank you so much for bringing that up, because it's infuriating to see how they're continuously, intentionally erasing in a hopes of minimizing our accomplishment for this storyline, continuing the diversity, equity, inclusion of undeserving and not earning the merit and for the positions. In my district, I've been hearing from some minority veteran contractors who said that their contracts are being heavily scrutinized with the underlining they didn't deserve those contracts and they're not performing. I want to know, have you been hearing about this? Because it seems like more and more of those contractors are pointing that out and that they're all going through that. Another thing I want to point out also, cultural competency. You know, we've been talking a lot about the cultural competency that's actually needed to serve our veterans and to make sure that it's actually being intentionally inserted into the VA so every veteran can actually have the real care they deserve and not care that is less than substandard, right? So if you have any ideas about that, because I think that is something that's not just necessary within the VA, but for anyone who actually is treating our veterans who might be in community care, that they all should have a standard of cultural competent training so we could protect all of our veterans. And the last thing that I wanted to mention was about what you talked about, the reverse discrimination. I think that is exactly where we are right now, where a lot of people want to avoid any issues, and so they will go to what they think is simplest and what will not be questioned. And that directly impacts us and our economic mobility for our veterans and their opportunities. And so if we are not cautious and vigilant right now to keep standing up and pushing back, we're going to find ourselves in a position where we'll be further behind than when we started.
Thank you. Thank you for that. Thank you. That was very well said. Thank you. Any response? I mean, well, I've got a number of, I'll just go through my list here. Mr. Brookshire.
Oh, yes. I think the work that we're going to be doing, the work that we'll be focused on in the next year or so is really archiving a lot of the data that we've had and making it publicly accessible. And so whether it be through what we've gleaned through FOIA, collecting veteran narratives, specifically the folks that are participating in monk litigation or claimants to litigation, and any other kind of reports, the ones that James mentioned, and working with some academic partners to produce some white papers. So it's just like making sure that it's all that we've that we're able to find that the VA has buried is just made publicly accessible. I think the other thing that I want to point out as far as something that is incredibly necessary to push on is the continued data tracking around race and gender. I just think about the PACT Act being the largest piece of veterans legislation in a generation or in generations. And the fact that disparities will likely continue because of the dismantling of the Office of Equity Assurance and programs like it, that if we're not tracking race and gender, it's going to be very difficult to even have a path back to correcting course. And then I also just wanted to raise, Black folk are still up to 2.3 times as likely to exit the military with an other than honorable discharge. And so you still have a large confluence of folks who are immediately locked out of their benefits. And there are some kind of discrimination that is occurring in the military even still that is affecting accessibility. And Monk had an other than honorable discharge back in the 70s, and it carried forward for decades, and it precluded him from being able to access benefits. So any work that can just still be done around that, and I know that's a different committee, but there's an interrelation there that I think is always important to continue to recognize.
Yes, well, thank you for bringing all that up. Danny Vargas.
So to Congresswoman Ramirez's question earlier, one of the things that I think is important to bring up to the Secretary, we signed down to a letter from the Center Responsible Lending on the cancellation of the Veterans Affairs Servicing Purchase Program. Upwards of 75,000 veterans who are having issues with their mortgages and loans might be affected by this. I think to your question, Congresswoman, I think the cultural competency is incredibly important. We know that, in our case, Latinos are disproportionately don't access the benefits that they have earned. And I think a good chunk of that is responsible for the lack of cultural competency, whether it's language accessibility or whether it's, frankly, reaching out to family members who can actually get to the veterans. Some cases, it's much more beneficial, much more productive to engage family members, spouses, offsprings, parents, et cetera, to be able to convince those veterans to actually access the benefits that they've earned because, to Christina's point, some of them just don't feel that they should move forward and actually raise their hand and say, I want to access those benefits. So there's something much more proactive that needs to be done to communicate with these particular populations. And Edward, I would point out also that Roberto Clemente was also a veteran. He was a United States Marine. So he said that his Marine Corps training actually helped him in baseball. But thank you for the question.
Well, thank you. Shall I go to this or go to these people? Okay.
Thank you.
I'm going to go to, I'm going to call on James, Christina, Peter, and then Megan, and then we'll move to a different topic, focus. But so, James, go ahead.
Yes, sir. Thank you. I think, as Michael says, I think we have enough data to understand what the problem is. We need to continue to collect that data, but we have enough data today to understand what the problem is, and we need to act on it. And whatever the solution is ultimately needs to be as intentional as what caused the problem, as intentional as the discrimination that's gone on for years against Black and brown veterans. I'll give you an example. DOD, back at the end of the Vietnam War, was running out of people to fight the war. So they came up with what I'm calling a feeble soldier program, where they lowered the ASVAB scores for you to be eligible to become a soldier, and then recruited 1,000 soldiers out of Louisiana that were ill-prepared to go to war. Those veterans went to war in Vietnam, mostly Black, like 90% of them were Black. They came back from war, and most of those were denied their benefits when they came back. So that was intentional, and whatever solution we come up with has to be as intentional to overcome those historic discrimination.
It just makes me, what you just told me is it's just so horrible, what you just told me. We've got to do something. Christina.
Yeah, I just wanted to add another note about the cultural competency. Mandatory training should be required, more mandatory training should be required for community care providers. That's where there's a huge gap in cultural competency. They are, as far as I know, they're required to take training on opioid prescribing, but there's so many things that these providers should have mandatory training on: military sexual trauma, PTSD, and a variety of other things. If with lacking that cultural competency, they're not going to know how to properly interact with veterans and veterans of all groups. So we've heard proposals like that in the past, but we would definitely support more mandatory training for community care providers. Thanks.
That's a big point of contention with the third-party administrators, and huge frustration with VA and why they won't implement this, what you just said. Peter Perkowski.
Thank you, Congressman, and I wish the Congresswoman were here to hear this, because it does directly answer her question on cultural competency. Cultural competency is the reason LGBTQ veterans don't trust the VA. I should say cultural incompetency. And when they do access VA, they don't feel welcome there. We have been working with VA over the years, especially under the Biden administration, but for years before that, to improve that. I think it did improve. There was the VHA Directive 1341, which has existed for a long time, but just in 2020 or 2022, put in specific kind of policy directives about how to approach the care for transgender people. And it was culturally informed, and it was the right way to do it. That directive was repealed or rescinded by this current administration. So currently that care is not going to be culturally provided. I don't need to remind you, Congressman, that starting like right now, thousands of transgender service members will be separated from the military, whether voluntarily or involuntarily, and they are going to want and need care from VA, whether it's from the VA itself or community care, which I join with the previous comment. So those things are important. I don't know how to solve them, given the current makeup of Congress and the administration, but I do want to make sure that you and the other committee members are aware.
Thank you for bringing that up. I'm just reeling from the decision itself of the court to allow the separations to occur while the underlying issue is being litigated, the substance of that litigation. I can tell you, as somebody who identifies as gay, that I will validate what you're saying about whether you trust a healthcare provider by the questions they ask, what they invite, what their curiosity about your health. Definitely can translate my imagination to what it must be like for a woman veteran to interact with a provider who may not even have the forethought to ask if they're dealing with a woman veteran. You know, 1 out of every 3 or more are screening positive for military sexual assault. If that provider is not trained to ask the question, number 1, or even be curious, 2, even know what to do, and all the other kinds of things we know women veterans may not access because they're dealing with that trauma. We can see how huge swaths of our veteran population will not be served. And it pains me to think about how we're going to have to deal with these veterans who are being separated and are entitled to VA care, and the fight we're going to have to fight. It's going to be, I can already envision the fights we're going to have to take, but thank you for bringing that up.
If I may, they're entitled now. We don't know whether the future kind of direction of VA will start to remove that care from the benefits package. But when people show up now for that care, which they are entitled to, they're going to be misgendered, and that's good.
No, it's the whole madness has infected the VA, and it was kind of working with some of the transgender organizations, we kind of kept it low-key, that you could get care at VA, but the extremists have discovered that VA does this, and they've gone after it. So I appreciate that. Megan Miller.
Thank you. I just wanted to say it's very hard to have hope in this moment, but what we have, we need more data, and I know I've spoken a lot about needing more data, but we know what the problems are already. We need the data to prove where to go first and what's effective. We've known since at least the GAO study in 1982 that women veterans weren't getting the care they needed, and that they needed a women's center, that they needed their own entrances to medical centers to feel safe. When we know that the other than honorable discharges were disproportionately handed out to minority veterans, this summer in 2024, there was regulation change to try to address some of those historical problems. And it's not a fix-all, but it's a step. We know that these problems exist, and we can be intentional to address them. We know a lot of veterans aren't coming to us because of language barriers. So Puerto Rico was translating a whole lot of correspondence, and they were sending out correspondence in Spanish, and it was a great effort. We know that there are great inaccuracies in MST care, so they centralized that claims processing and the oversight. So these are all things we already know. We can take intentional action to make things better. And a big part of that is the cultural competency of understanding that it's needed and making sure that people understand in the general public what we're trying to accomplish. Thank you.
Thank you. Morgan, do you have anything you want to bring up?
Thank you. I'll call you Mr. Chairman. Thank you, Mr. Chairman. You know, so much of this is so disturbing. It's both good for us to hear and I mean, just a kick in the stomach, honestly. You know, when you're talking about going and intentionally recruiting people to go to war and then denying them the benefits. We know some of the stories, of course, from World War II era. You mentioned the schools, and even to clarify that point, when we talked about black veterans not being able to get into schools, I should just clarify, through no fault of their own. The University of Louisville was not integrated until 1951. The University of Kentucky was not integrated until 1949. It was through no fault of their own they did not get these benefits. What do we do? How do we thoughtfully take care of these past wrongs? And what are some things we should be focused on solutions-wise a little bit? Do you have any ideas?
So Morgan, just so you know, we have legislation that Mr. Clyburn is carrying. I don't know if it's both the home loan and the GI Bill, but there have been ongoing discussions. So just know that legislation is ready to go at the right moment. And I think most Americans, we can make the case to them, especially since on the home loan, to do the home loan fix, it's not going to cost us really money. It's going to actually probably make us money. So to right that wrong. The education, the GI Bill repair and fix is going to cost us some money. Whether one descendant of those veterans that were denied or all their descendants should benefit, that's kind of the conversation that's being hashed out. But we've got some instruments, and we got to build support for all of this. I mean, we're in a moment where I think Sheila was talking about, we're kind of walking on eggshells, trying to say things that don't seem like it's reverse discrimination, and how it's important for us to still stand up for, I mean, we've got an administration that doesn't even, the secretary bragged when Mazie Hirono asked him, how much money have we saved from all these cuts? And he couldn't tell her the number. He says, but we saved $14 million on DEI. And I'm thinking the DEI money he's saving was like he eliminated this office. that puts together all the data. I mean, I don't want to, today when I ask them the question, I'm not going to waste my time asking that question because it's just going to give them a platform to go off on DEI. So the tactics, I mean, we have to kind of clarify our tactics, maybe focus on this question of cultural competency with care in the community, because that's where this administration is likely to go. But anyway, I see other cards up. I see Mr. Wishney.
On the question of where do we go, these are the big things. We're talking about the big things, and that's going to take time, of course. I hope that you all will continue to question witnesses when they come before your committees, make them say out loud, what are you doing about racial disparities? What are you doing to care for trans veterans who've been involuntarily separated? What are you doing on all of these? But I wanted to offer, maybe in this spirit of, is there any space for common ground and progress? One small thought, one suggestion here. As you know, many recently separated women veterans identify access to fertility care as one of their top priorities. Veterans have higher rates of infertility than civilians. The military has historically not been that interested in studying reproductive health and women's health, so there's not a lot of medical evidence. So when women try to get fertility care at the VA, they're often told, prove that it's connected to something that happened in service, but there isn't medical evidence to connect stress or burn pits or toxic exposure, other things that would explain the infertility. So as a result, very, very few veterans have access to fertility care. Most important is IVF, in vitro fertilization. Right? And last year, of course, the House passed legislation that would have expanded access to VA, and so did the Senate, and it fell apart in conference last year. Now, our new president says he is the king of fertilization, right? He said that during the campaign. And one of his executive orders in that blizzard on February 18th was an executive order to reduce regulatory barriers to accessing IVF across government, February 18th of this year. And he gave the federal government, all agencies, 90 days to report recommendations to him. That's May 19th, next week. So agency recommendations to the king of fertilization about how to reduce regulatory barriers to IVF are due next week. It may be, and I don't want to suggest that this is at the same scope or scale of the big questions we're talking about, but it may be that expanding access to IVF care for all veterans would be an area of common ground, and maybe we can get that done this year for the odd reason of the change of administration.
Thank you for bringing that up. Thank you for bringing it up. Of course, we're going to run into issues about whether it's available to unmarried people, whether it's available to LGBTQI and whatever. But I do think just getting this done, have I my druthers, I would do the Julia Brownlee approach, which is to just say IVF and fertility is a part of healthcare, and say that whether it's military healthcare, VA healthcare, we just established a principle that there's other steps to get the fertility. IVF is kind of one of the last recourses, but we address it and just include it in the basic package of benefits, right? Let's see, we have Christina, go ahead.
Yeah, I think also a good point was brought up about gaps in research. We've identified lots of gaps, particularly for women veterans, when it comes to research on just understanding the impact of military service on their mental health throughout their different phases of life, including menopause. There's very little research on women veterans during menopause. So identifying and trying to fill some of those research gaps would also be really important. Thank you.
This is really good. This is the stuff that you wouldn't think about in your John Retzer, John Retzer. Why don't you speak into the microphone if you could?
Wanted to address a question that you had. You know, what do we do? How do we go forward? And I think Michael had hit a point that resonates when we look at this administration and what they've already talked about. And they've been on record talking about how they want to streamline the efficiency. They want to look at reallocations of resources, along with concerns and criticisms that are surrounding how they're being transparent or not transparent. In their own definition, they're being transparent. As Megan has talked about, you know, how they as employees are given certain levels of training and they're able to do what they can do. It's not always a systemic issue as far as a collective department line or a service line. And we've heard about cultural competency within the VA and outside the VA. I think what we need to do is there has to be this level of transparency, but that level of transparency has to be redefined collectively with all of us. Because I think we all agree, every one of us, I've heard us say, all veterans. But what does that really mean when we hear Secretary Collins also speak about he wants to ensure all veterans get health care and benefits access? We've heard the administration, we've all testified numerous times on all veterans. And we've also talked about how important it is to have cultural competency. For example, like Megan was talking about, when a claims process happens and a veteran, no matter what their branch of service, MOS, combat, not combat, gender, or whoever they love or don't love, that concept, when you go into community care, these physicians who are contracted and not contracted don't have cultural competency in military. They don't understand that, like Christina said, women being asked by VA, are you the veteran? We've heard that story many times. And I have a peer in my office who, his wife is a veteran also. And they did not consider her to be a veteran. It's absurd that we hear that. It's not common sense question. We should already know. One thing, when I was in the Army, and I think many of you remember this, whatever branch you were, we were one color, one team, one fight. I wore green. That's what the Army wore. And I remember a commander said, look in front of you, look to your left, look to your right, look behind you. You may see something different, but in my Army, you will see nothing but your team and the people who you will support, their six, and they'll cover your six. And I think that's what we need to have this hard discussion and find out. Where do we align with each other? Where do we agree so we can move forward? Unfortunately, the Office of Equity Assurance is getting sunset. It's an unfortunate thing, but how do we leverage the Veterans Experience Office? How do we leverage them, and how do we leverage the Office of Enterprise Integrations as they're going to move in this very policy-driven, but this isn't about policy. This is about veterans who are human beings. They are real. Their service was real. Their combat experiences are real. Their PTSD is real. All their health disparities are real. So how do we address that by having an office that we already have in play to encourage the administration and Congress to support VA to help them through legislation, codify protections for all the groups we're talking about, the minorities, LGBTQ+, our women veterans, ensuring that research is in the forefront, budgets and everything is there. I think we just have to get back to the table. We, DAV, have offered the Secretary, this administration, and Congress that we're willing to come to the table, agree to disagree, but let's talk about where we can move forward. And what I looked in preparing for this, we have data. I'm a veteran. I am a disabled veteran. I use the VA healthcare. I am one of the data points. I use VA 100%, but for one thing, my eye care, because it's just not accessible as easy. But the thing is this, as a veteran, our data is here. We are the voice. And one thing I pulled up for VA was this, 2025 quarterly report indicated something. The trust in VA overall has dropped. Our male and female veterans have dropped by 1%. And what's discouraging to see is in our gender side of it, the younger generation have the highest concern and trust with VA. That's discouraging to see, let alone we have had discussions with regards to the aging population. That's one level of discrimination that can occur, but now you put their race, ethnicity, their different biases that may come in that may play against them in multitude of factors. So I think that's what we got to do is have these hard conversations. We invite the Secretary of Veterans Affairs to come and collaborate with us. We understand and we champion many times. Christina and I have been at the table, and Ranking Member, you've seen us. We have championed VA when they do great work, but we're going to hold them accountable. And that's the other part, Representative, I think to your question, where do we go forward? And I think Ranking Member did a great job the other day when we were talking about the claim sharks. There are already laws that were signed and passed to protect veterans. We have multitude of laws at the federal level that already protect minority ethnic groups. Like you said, we need to hold them accountable and enforce the laws that anything that is done against all veterans, that they would be held accountable to what the laws require.
Thank you for that, Joe, and I think going forward, I appreciate the voices of the VSOs out there. This is going to be really important in terms of holding this VA accountable. Danny Vargas.
So just to the Congressman's question, and it's a shame he's leaving, but I think part of it is, we can push back on the narrative as well. We know that the nation's going to be majority minority within 20 years or so. Same thing's going to hold true for our veteran population. Pushing back on the narrative around DEI right now, it's not a touchy-feely, warm and fuzzy thing. It really is an economic imperative. It's a national security imperative that we engage these communities. These are proud, patriotic, brave, courageous Americans who have served their country well and faithfully. This is a population that can be an important part of our workforce moving forward. They are trained and talented and capable. They are the entrepreneurs of tomorrow. These are the people that can start and grow successful businesses through their hard work. I chair an economic development initiative in Northern Virginia, and workforce development and entrepreneurship are at the top of the list of making sure that we can keep our economies moving in the future. This particular population of veterans are the ones that are going to be filling the jobs and creating the businesses that we're going to need to be successful in the future. So there's an element of pushing back and changing the narrative around what DEI is and what it isn't. At the end of the day, it really is about engaging communities in a productive way that will be impacting our nation and our economy and our national security moving forward. So I think there's an important element to say that this is not just a nice thing to do, it's an important, vital thing to do.
Thank you, Danny. I agree. We can't stop saying diversity. It's a great word. Equity is also, who can argue with that? Inclusion, who can argue against that? They've turned these into like dirty words. They're not. And I go back to what Sheila was saying earlier. I say it a little bit differently. We the people, in order to create a more perfect union. The founders knew very well the nation, the union they were forming wasn't perfect, and not everyone was equal. So we've been on a journey to diversity, equity, and inclusion. To me, it's actually the heart and the purpose of the country to get there. And it's not the bugaboo. It's not the enemy. It's actually the core purpose of who we are as Americans. Larry Romo.
In 1976, I was 20 years old, and I was a cadet at the Air Force Academy. I was a sophomore going to a junior year. And the class of 76 was the official bicentennial class. It was the 200th birthday of the United States. Only 1% served, at my suggestion to my fellow people and to Congress. Unfortunately, there's been some turmoil with America's 250 Commission, and it's been really low-key. But we're trying to kick it up from this Memorial Day till 4 July 2026. That's the official celebration of the 250th birthday of the United States of America. We're a melting pot. And I suggest that since we're only 1% to serve for veterans, that all of us emphasize programs, that you all establish programs like the 4 major Hispanic organizations. I was originally the idea, but Danny's doing most of the work, and the people in the D.C. area. We're going to honor all the contributions of Hispanics for the military veterans since the birth of our nation in either May or June 2026 with a big event in D.C. And I would encourage you all, and I would encourage the Congress in their districts and nationwide to showcase more military and veterans programs. I'm not talking about the big parade that's supposed to have here June 14th. I'm talking about, local national programs to showcase what the military and veterans have done for our country, because that way the other 99% can understand what we've done, and that will show the needs for the veterans, and people will appreciate the veterans more, not to cut the jobs like they're trying to do in the federal government now, and to cut out veterans programs. I think it's important that we showcase America's 250, because this country would not be here today if it weren't for the military and the veterans. Thank you.
Thank you. I appreciate that, Larry. Ed DuBose?
Thank you, Mr. Chairman. I would like to just lift up the first paragraph of a letter by Senator Gillibrand, Hirano, Duckworth, Congress members Sherrill, Houlihan, and Gardlander that our members thought was important enough to be before you. We write to urge the reinstatement of the Department of Defense. This letter was written to Secretary of Defense Pete Hegseth and Undersecretary of Defense for Personnel Readiness, Ms. Julia W. Hurst. We write to urge the reinstatement of the Department of Defense Advisory Committees, particularly the Defense Advisory Committee on Women in the Service, the Defense Advisory Committee for Prevention of Sexual Misconduct, the Defense Advisory Committee on Investigation, Prosecution, and Defense of Sexual Assault in the Armed Forces, and Military Justice Review Panel. On April 23, 2025, you directed the conclusion of services of all Department of Defense members on the aforementioned DoD Advisory Committees and panels. These committees have proven essential to constructive improvement and progress to our military's capabilities and missions over several decades, and we fear their removal will provide detrimental to our armed forces and readiness and lethality. I wanted to just lift that up because that came from the women veteran who fear the takedown even of their program, sir.
Thank you. Thank you. We're kind of nearing the final stretch of our time together, and I wanted to, we kind of moved through the flow of discussion topics pretty organically. This whole moving forward section, I felt people here, the participants addressed the moving forward part. I really appreciate Michael Wishney's suggestion on a particular consensus. I'm even thinking that could be a discharge petition. I mean, it challenges the president in a particular way, and I like it. I want to just take this moment to say, to take the moment to offer everyone maybe a final comment, if you want. Any final thoughts before we go? Okay, well, Michael, go ahead.
Sure. First, thank you again and to your staff who did all the work to allow this to happen. I really am grateful for it and for whatever comes from it. I think there's been a number of ideas here that I hope there can be follow-up on. One thing that hasn't been said, so I thought I would say it now, is that I think that it's important for us to be ready should the midterms lead to a change of leadership in the House. There will be opportunities for, additional oversight and compulsory process and things like that. And it's hard to look ahead a week, a month in these times. There's so much coming at us. But I think if we're not prepared for that possibility, and I'm not suggesting we're not, but I hope that we can be, so that we take immediate and fullest advantage of the additional tools that might become available.
I think from this group's perspective, from the common interests we have here, noting the losses in institutional, sort of instruments, administrative instruments, such as the Office of Equity at VA, we do need some planning as far as what would be the first steps if there were a change in power in one house. What would be the steps in two houses? We would probably look to the NDA process and the appropriations process, right? So there, what are the concrete things we can begin to do? And some of you have been at this legislative task for quite a while for your organizations, and so there's some very specific surgical, tactical things that we could do, and so we need to start compiling those things, have them ready. So, you know, I learned this from Dr. Salvatore Rotella, who was the chancellor of Riverside Community College for almost 20 years. And I, as a young kid at 30, hired him. And we faced, right into when he came into office, a depression, a recession in California. And his leadership was, in the moment, we were in sort of a down, we had to cut all sorts of faculty and students' course offerings. He says, this is the moment we plan. We take this time when we're in a retreat to plan. And so let's consider this group here a planning group. Stay in touch and work with my staff, and let's build out a plan for 2026, imagining different scenarios and what would be the first things we would do in the first 100 days. Is this? James, go ahead.
Sorry, wouldn't stay on. It seems like behavioral health issues are a particular challenge, especially related to gender and military, cultural competency. And if a person isn't trained, particularly a contractor, isn't trained in those areas, they can interpret the same condition differently across different spectrum. There was an effort at one point, I think the IG had seen a situation in one of the Midwestern states where the rates of PTSD were much lower than they were in the rest of the country. And it was because internally, the people in that community, the practitioners in that community, you're aware of that, were interpreting PTSD differently than people elsewhere. And given that it's subject to interpretation, I would recommend that, particularly around military sexual trauma, PTSD, and TBI, that there be mandatory training across all contractors, all VA practitioners that assess that, and that training has to be updated every 2 years, like most other medical professionals. Because I think that part of the problem, particularly in Puerto Rico, is that there's a big discrepancy, and we talked to the examiners in Puerto Rico, is that there's a big discrepancy around how they interpret PTSD versus folks in California or elsewhere. So that's one option. The other option would be that potentially look at these behavioral health issues under certain guidelines and within guardrails, a presumptive under the PACT Act. It's very real that if you're, I was in the Navy, if you're in a turret firing 5-inch 54 bullets onto a shore somewhere, the impact of that is going to have an impact on your brain. There's a lot of data on that. There's a lot of data on just the burn pits and PTSD and the association between that. We've gone a long way in designating some of these conditions as presumptive. If you're in this environment and you meet these criteria and you say you have PTSD, you have PTSD. Make it a presumptive.
So you're bringing up two things that are somewhat very different. So let's focus on the presumptive process. How do we get, how do we pressure for more presumptives to be established? As you were talking about the different ways in which PTSD is understood by different practitioners around the country, perhaps you could help my staff develop a way for my caucus members to do oversight at their VMAC locally. Is there a way for us? I mean, we have limited oversight abilities given where the majority may put their emphasis, but there may be ways in which we can make my colleagues effective oversight agents, give them some agency to go and, what are the questions we need to ask? What things should we focus on with that medical center director? So give them very specific things to do to improve.
It'd be interesting to take a handful of different locations and take 1,000 CMP exams from each of those locations and examine how the examiner is looking at them and look at the variability in those examinations. And I think you'll find that there's a lot of variability. And it depends on, and you'd have to do it geographically across the country, not in one state, for example, but there's a lot of variability in the way examiners look at CMP exams. I think you'd agree with that.
Well, I mean, I have a travel schedule I mean, it could help inform the way in which, you know, when I meet in different regions around the country, that we include in that travel schedule this question of the CMP examiners, many of whom are contractors, right? So, excellent point. Who is next? Ed DeBose.
Yeah, my final comment, I really want to just say thank you.
You're welcome.
Allie was absolutely awesome. I hope that our organization will remain a part of this conversation. I would love to be updated so that we can make sure that we're working as partners, as a team on these issues. Two of my members, one of them, Dr. Antonisha Williamson, is in your district. She already had told me to make sure I said hey to you.
Who is it?
Antonisha Williamson.
Oh, Antonisha?
Yeah, she leads our Armed Services and Veterans Affairs Chair for the state of California. And our other member, Octavia Harris, she had did some work with you in 2021. So I was already briefed that you had a genuine interest in the concerns of veterans, and I appreciate that.
You're welcome, sir. And I do want to I want to work with everybody here on these issues. It's a commitment of mine, and knowing the leader, the Democratic leader, these are issues close to his heart too. I wish he were here. I mean, he would be. In fact, that might be an idea that we get some sort of meeting with the leader of the caucus, because I know that he would. I shared an article with him. I talked to him about the 442nd Infantry Battalion. He came to the Asian Prom, the Asian Pacific American Institute for Congressional Studies. I can't believe I know that acronym. But he addressed the AAPI community for AAPI month. And I told him how to say 442nd. He kind of read it off the teleprompter. But I told him the story, most recently told in the Washington Post, about how the artillery unit, advanced artillery unit of the 442nd was involved in the rescue of Jewish prisoners of Dachau on the death march away. And Debbie Wasserman Schultz, my colleague, didn't know that story. And Hakeem represents some Jewish communities, and this really I could see it caught his attention. And we were in a crescendo meeting. I handed him the article, and he thanked me for that, because I just know he's going to use it in some speeches. But the 442nd served alongside many of the segregated black fighting units, and Senator Inouye tells a story about the blood transfusions that he received when he was losing his arm, and that he believes that there were they would actually do direct transfusions from somebody whose blood type matched the other right on the field, that he had the blood of African Americans that saved his life while he was on the battlefield. And so Mr. Romo, I would suggest that the other date that we uplift is the date that Harry Truman integrated the armed forces, and we tell the story about why and how he did that. It just didn't come out of nowhere. It was in reaction to a horrible incident in the South where a black soldier was blinded. And I view the post-World War II history of our armed forces as a really important part of our civil rights history. And so anyway, this is something that I believe I share with our Democratic leader. He's getting his footing in veterans issues and all that. So who's next? Is it John?
Thank you. Thank you, Ranking Member, for doing this. This is a very important topic today that we're discussing, and obviously it's about all veterans. And these veterans, unfortunately, that we are talking about specifically have very specialized needs. And one of the things, I think what James was talking about with regards to, cultural competencies and training, I think some of the important things surrounding that, like there's a piece of legislation right now looking at portability of license, to have physicians who conduct CMP examinations that could actually create the internal VA doctors who do CMP examinations who already have cultural competency. And Christina's absolutely correct. The VA requires only out of community care is substance use abuse. That's the only required course, and that's a very simple course. But I think one of the recommendations I would love to see Congress do is to look at the requirements of the courses to integrate more cultural competency of all veterans' perspectives and really emphasize very specific training components on the cultural competencies of if you are LGBTQ+, women, veteran, and really dispel the myths and the shroud that's around that have people confused about what their needs are. Second thing is looking at legislative pieces that really continue to address comprehensively. When we don't address their diversity, that is not addressing their mental health comprehensively. When we are not addressing their economic disparities because they are a small business minority owner, we are not addressing their mental health or their family structure needs, which family is very important, as we have seen with caregivers, providing the support that they do for our veterans. So this is a socioeconomic issue that we need to continue to hope that Congress, the administration, and VA understand if it's going to be about all veterans. Please continue to be thoughtful.
Thank you. Thank you. Thank you for that. CMP is coming up as a theme here. Larry Romo.
Just real quickly, it's been my honor to work with you since I work in the Obama administration as Director of Selective Service. I've interacted with you at different locations.
Sure.
But what makes a strong ranking member is a strong staff, and I want to compliment Cassie, Rosa, and John Harry. I probably know some other people here because they're the ones that did. And the last quick thing is, your story, I got to add to it. I was honored to be on the naming commission. Congressman Smith appointed me, and it was 8 people. I was the only Hispanic on there, but I'm very proud of Fort Lee, Virginia. Now it's Fort Gregg-Adams. Charity Adams is 6666, but Arthur Gregg's an interesting story. He was the first black 3-star general quartermaster. And what's interesting about him is when he came in the military in 48, in 49, even though Truman had desegregated the military, they were still didn't allow any blacks in the officers club at Fort Lee, Virginia. When he was stationed at Fort Lee as lieutenant, so he couldn't go. And then he was still alive. He was the only one who was still alive when we renamed the base. He came to the ceremony, and I went to the ceremony. And now Arthur Gregg's picture's on one side, Sherry Adams is on one side, and the Officers Club named after him. So that's how far we advanced civil rights. So I was very proud to meet General Gregg Adams. Now, we've been fighting the Secretary of Defense because he's been trying to change names. But luckily, we have Congressman Austin Scott that's helping us, Republican, that was on our committee, to tell him, heck, Steph, please don't change more names because they're very upset for Hal Moore's family when they renamed it back to Benning. So we're trying to prevent them to rename the bases. So please help us fight that fight too. Thank you.
Sure thing, sir. Sure thing. And wonderful to hear a little more of your history today and your military academy experience in the 70s. That's quite amazing history. Christina?
I just want to thank you for hosting this conversation. I really don't think that we can address these disparities without having conversations about how it is important for not only all veterans, we want all veterans to access their care and benefits. We have to acknowledge that it's important for women veterans to access their care and benefits. It's important that Black and Hispanic veterans access the benefits they've earned. It's important for us to reach veterans on native lands that serve at very high rates but are underserved. We have to acknowledge that it is important for LGBTQIA+ veterans to access the benefits they've earned. We are, as a nation, very focused on suicide prevention, and this is all connected. Mental health is connected, but also veterans who served deserve to access their benefits. And so we cannot talk about all veterans without identifying where these disparities are. And we look forward to working with you and other members of Congress to try to achieve that. Thank you very much.
Thank you, Christina. Thank you. Thank you all for joining us. I too want to express my gratitude to my staff. They are an incredible team, and led by Matt Reel, who, all the different staff directors of the committees. They're just an excellent group of people who really do care about our nation's veterans. And before we close, I want to acknowledge that we were joined today by Carol Whitmore. This summer, Carol will become the very first woman to command the veterans of foreign wars. So we are honored by your presence today. And I'm sure things are ticking off in her brain about how a major VSO can advance the concerns that we have here today. And we've got to try to do what we can to mitigate the losses. But how can we, I think in the spirit of what John is saying, how can we tactically move ahead with what we got? And so with that, I've got more work to do elsewhere. Thank you. I think the leader would. I think the leader would love to.
Yeah, I think
He would love it.
Have we done any interaction?
Yeah.
We're mostly active in the Northeast because we're in Connecticut. So you guys are.
We're all over. We're New York, we're Connecticut, New Jersey. We're all over the place. You know that.
I know, but I also think of your strength as sort of Texas, Southwest.
You'd be surprised. New York, our president, we've had national level in New York.
I don't think I've ever run into LULAC in Connecticut. Is there even is there a chapter in Connecticut? Is there a chapter, a LULAC chapter, or?
Connecticut, yeah.
I've never, I have to be honest, I do a lot of.
You know what I like to do? What do you do exactly? In 30 seconds or a minute.
I'm a professor at Yale Law School, but I'm a clinical professor, which means instead of lecturing, we have like a civil rights law firm. Students work on the cases as part of their training in law school. So I'm also a civil rights lawyer as well as a full-time professor.
Would you work
Okay.
with the
Yes.
Well, let's do this. I think there's some things that we can join you guys. Of course, we've done that with overseeing National Urban League. And I'm the veterans portfolio. So Michael, what I'd like to do, if you don't mind, can I schedule a Zoom meeting next few weeks with our national president and you? Just and you can join us. Yeah, because